Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody. I hope, excuse me, I hope I have a frog in my, I never understood what that meant. Is there a frog really in there? Get out, Kermit. Okay. So, everybody, we're here for another great, exciting show. Some information that's going to actually blow you away. Everything documented. I want to say hello to Nutter, who's our producer in there, making sure that the show goes well. Freddie S., and Dr. Pannozzo. Without you, there is no show. So, Doc, you tell me about... Well, yeah, it can't be the Dr. Pannozzo show if you're not here.
There's a tape.
You're very important. I've been doing a lot of research on something that you and I have spoken about over the last couple of months about overdosing. And you have some alarming figures, and I've got a lot of alarming figures that's going to prove what you say. So talk to us about prescription drugs. Oh, boy. Opioids, is that how it's pronounced?
Opioids.
Yep.
The problem with the opioid thing is the MDs are prescribing it too much. If you go to the hospital for something minor, they'll put a narcotic on you, and you have to refuse it. And they'll say, why are you refusing this? This is for pain. I've been there myself, and this is what they do.
I refused it when they gave it to me.
Aspirin's good enough. You don't need that. And they go back, like, what? Jeez. Well, that is the truth. You don't need narcotics for most stuff. In fact, lower back pain, you don't need it at all.
So they give it to you when you're in the hospital?
They do. They force it on you.
And they're giving you this, why?
Because somewhere down the line, the makers of the narcotics, the company that produces them, got to the boards, medical boards, and let them feel guilty about, all these people have all this pain. And I watch it go over the years. Remember, I've been doing this 50-some years. Over the years, these pharmaceutical companies started with one little desk, one little guy, and they ended up with 3 or 4 tables with 5, 6 guys selling the narcotics at the end. And it was a tragedy to watch this going on. And how they did it was to make the doctors feel guilty on the boards. So if you don't prescribe those, that means you're neglecting your patient. That's the stupid thinking that goes on with this. This is not right. And of course, you're making a junkie of anybody.
Well, according to the National Institute of Health, they're finding out that opium, which is big, and all those other drugs that are big, have nothing to do with the pain medication. The pain medication is leading almost 49,055 overdoses for people who have pain. Are you getting an echo, Freddie?
No, what is I don't get the point here.
Well, they're prescribing, there's over 49,000 people who have passed away due to taking prescription drugs for pain.
Oh, that's the narcotics.
Right.
Sure.
So here's the thing that I want to bring up. If someone goes to you and you get rid of the pain, the doctors that are, I guess for lack of a better word, that prescribe these medications, or rehab doctors, would have a better chance of helping someone.
No, the narcotics has nothing to do with the pain.
Right.
It has no effect on it.
Right.
So why do it? It has no effect on it. And the doctors are prescribing that like crazy. And they go back week and week and they do it over and over again. They got to stop that stuff because it's not right. It's not good. It doesn't do the job.
Well, so what you're talking about is it's like the weightlifter that came to see you, and they gave him painkillers. He was in a motorcycle accident.
Yeah, same thing.
And they gave him painkillers, and the next thing you know, he became
a junkie, and that ruins the life. That ruins their life. I mean, people call me all the time, and they have a story like, well, I'm from Massachusetts. I just moved to Florida, and I'm looking for a doctor to take care of my pain management. I said, what do you mean by that?
Management.
Management. And he said, well, I need my prescriptions renewed. I said, this is not the office for you.
Right.
If you want to get rid of your pain, we'll do it. We prescribe nothing. You don't need it. It's not good for you. You should not do it.
It's funny, I was talking to somebody at the gym, and said, does Dr. Pannozzo give a cortisone shot? I said, let me explain what it is. Okay, I've been there long enough time to know this. The key to any type of a shot, the one thing you have to know about is, where is that pain coming from?
Right.
You just can't arbitrarily give a guy a shot in the knee for of cortisone, because you don't know where that pain is coming
just
from.
Just get a shot is not the...
No.
It has to meet the criteria that we use of cause and effect. You see the effect most times, but you don't know where the cause is. So if you have a pain down the leg, so what?
Right.
There is no pain down the leg. I mean, it's a referred area. So where is it from?
Right.
That's what you have to go after, not the pain in the leg. See? So you have to. The thinking has to be there. If not, then you lose.
800-889-0267 to talk to the good doctor. I mean, this show is done for a reason, and as you can see, we have no sponsors. And if you really want to see the nuts and bolts of what Dr. Pannozzo does, go to Channel 19 if you have Comcast, or go to where, Freddy? WWEY 19. And you could see
That's the website for
the website, yes.
Because they use a flash player.
Now, you could always go to am2.t or Facebook or any of the other
Well,
websites.
today's show, for the first time, Dr. Pannozzo's on drpannozzo.tv live on Facebook.
Great.
He's also on AM2 TV videos. He's also on AM2 TV Productions. He's also on Freddy Fix-It page. He's also on Two Boys from Brooklyn because he's a sponsor on that.
Right. He's also on am2.tv and
He's everywhere.
and Pannozzo.tv. So what I'm saying to you is if you go there and look, you can actually see actual patients where Dr. Pannozzo is going through what he calls his getting to know you and find a pain. In fact, the one I saw on Friday was amazing, where you had this kid who was a football player, and the doctor told him to go to a chiropractor, and he told him to go to a therapist, and then nothing was good. So his father said, I heard about him on Leah's show. Greek, I'm sorry, I can't plug you if that guy came in from Leah. And basically said, I'm at my last wits. I watched this kid who could not move his arm. Frank, how soon before I get that way? Oh, never mind. And he was perfect. I mean, perfect. And the father said, how long is he going to be like that? You said forever.
Right.
And amazing. The coach sent him here, coach sent him there, and it didn't work.
Yeah, we should do a seminar for the coaches.
We should, Freddie. I mean, you're you're an ex-coach.
Yeah, you do seminars. Tell him, Doc.
Their thinking is...
That's what he was telling me.
Yeah.
They're not thinking properly. They don't think in cause and effect. They're thinking of, I don't know, pain in the arm, put an ice bag on it. Don't think that way. That's not the way to think.
Well, before I knew you, and when I was younger, that's exactly what they said. That I put an ice pack on it, it'll go away.
Right.
Didn't go away. Went to the doctor. He said, "Okay, let me prescribe a medicine." In those days, I didn't have all the problems I have now.
And most coaches today, they don't know an aspirin from a hole in the wall. They go by whatever the doctor's telling the staff says.
When I was working in Ohio, we had a regular program for coaches. Every year we had a seminar for them. And they came in droves, and they got an hours for that. And we taught them how to look at things. And I think it was a lot better than this.
I agree.
I'm putting right down here that we're gonna get. I'm gonna put together a seminar for coach. I'm gonna talk to Greek.
Yes, we need your expertise on this because you're the only one that's able to do it.
Did he just say that to you?
Oh yeah, that's
You want to stop writing it and continue the show?
Well, I want to write things down.
Yeah, we use shorthand. And the show's on.
Just jump in once in a while.
He has a short hand. Do you ever look at his hand?
Like this.
He's got one.
Listen, I wanted to touch on the fact that the $1 billion NFL lawsuit for concussions. Is
Oh wow,
now
good.
underway.
Oh, good.
Everybody, even Facebook, has a page
Really?
that if you have a reason, you were part of the NFL, and you have a concussion. I don't know, maybe you're running the water bucket.
Well, you know, they're getting. You're true. They're getting a lot of lawsuits now from the guys who are having pains in their heads, pains in their eyes.
They're producing lawsuits.
Well, they opened it up. They opened it up.
And they're all wrong. See, it goes like this. If you have a reasonable expectation of a disease process, and they give you a number to bill with it, you're going to find a lot of people billing on that number, and then they have to pay it. Same thing happens when we try to do an annulus injection. They don't want to pay for it because if they did, there'd be a million claims.
We're talking about Medicare, right?
Yeah,
okay.
That's Medicare. But it's all kind of the same thing. And this came from the American Journal of Orthopedics. Concussions in American football, right there. And so what do they first thing they do? A neurological evaluation.
I don't know what that is.
Yeah, me neither.
Well, they're saying, well, that's a brain injury, therefore you have to have
neurosurgeon,
neuropathy or neurological problems, including, so it includes cranial nerve testing, evaluation, motor sensory function, strength, and sensation, upper and lower extremities. That's your neurological. That never happens. So they're all normal. Risk factors for injury and prolonged recovery. They're talking about risk factors, and the only risk factor that there is that you have to worry about is they don't protect the neck. The rest of it's baloney. Acute home concussion management. What is the home concussion management? Nothing. You sit home for 6 weeks. That doesn't work.
You sit in the dark.
Yeah.
That could be fun.
Depends who you're in the with.
It says, we recommend athletes follow a regulated daily schedule post-concussion, including regular sleep-wake schedule with avoidance of naps. What does that have to do with anything?
I've been taking a nap every day since I was 18.
It's the best thing I can do for myself is take a nap.
Dude,
Regular meals. Again, what's that have to do with concussion? They're making this stuff up. There's nothing. Adequate fluid hydration.
That's right. You got to be fluid for your brain to work.
Light non-contact physical activity, that is walking. I mean, the whole thing is baloney.
That's why Fredo never got a concussion.
And this is what the doctors are using, this article here.
And you know what's bad about that? I've been in sun. I was in the sun my whole life. Okay, I ate everything that I love liver. I don't know if anyone here likes liver and onions. I have never ever had a migraine headache.
That's why?
No,
because you liver and onions?
No, because it says those are the trigger. They say that those are the trigger foods not to eat.
Let me finish this off. Okay. Vestibular, stabilizing vision while the head moves, and balance control. We know what that is. That's from the base of the head and the top of the neck. There's a joint there.
Explain that part, because a lot of people...
I'm explaining.
Okay, sorry.
There's a joint there.
Didn't mean to interrupt, boss.
There's a joint there. And in fact, we just had one yesterday, Friday. A lady was a dancer, and she had the shh on her right side.
Okay.
She was very fearful of any treatment there because she had
the
nerves. The nerves were injected.
Oh, okay.
And I said, you don't touch a nerve ever. That's the thing that you have to understand. Nerves are never a problem. They're just phone wires. They're just wires that take the sensation to the brain. And post-traumatic migraine, which is headache, and vestibular, the dizziness, is all from the same place. And they don't know what it is. They're blaming a concussion for this. That is not a concussion that does that.
You could put all the baggage on concussion.
I did the research, and it's going to cost them billions of dollars.
Oh, God,
it's already at $1 billion.
It's craziness. It says cervical spine, finally at the end, and it's only one sentence. Cervical spine can be injured during whiplash-type injuries. You should never use that term. Therefore, determining location, onset, and typical exacerbation of pain can be helpful in identifying cervical involvement. Symptoms typically include headache, neck pain, numbness, and tingling. See, all the rest of it doesn't matter at all. This is the thing. Anxiety and mood. Anxiety is produced. Of course, if you scare somebody half to death, they're going to be very anxious about it. Yeah. So anyway, that's the kind of thing that people are reading out there, and it's going to filter down to the coaches because that's how information gets around.
Well, it's got to be. Yeah, it's got to be filtered down, because I think what's happening now is people are starting to understand that concussions aren't caused from the brain. It's caused from,
the neck. And you know what? I've never been challenged on this.
No, if you want to challenge Dr. Pannozzo, we don't mind. 800-889-0267. We'd love you to call up and see how much this man knows. I mean, you know what? We talked about so many things over the years, Freddy, and now everything seems to be coming to fruition. I mean, whoever was, you talk to, I got a terrible migraine. My doctor said I sit out in the sun too much. I sat out in the sun for 25 years and I've had a migraine.
Wait, hold on a second. I have a different question.
Okay.
From Facebook, they wrote in. I have a different question. You talk about that the concussion, he's saying the concussion is in the neck area, correct?
Right.
Then they want to know what your take is on clearing it up.
Well, you just treat it. There's a joint there.
So it's like a migraine situation?
Yeah.
All right, so why don't we explain that a little bit?
Dizziness, migraine, and hissing, ringing is all from the same place.
And vertigo.
And every one of them has an accident in their past. Motorcycle accident, automobile accidents, 2 or 3 of them, rear-end collisions. They all have it. All you have to do is ask about it, and you'll get it.
Okay, I'm going to say something to you. What you said. My friend was in an accident, was hit in the back. Okay, now he's experiencing pain all over his body. I said to come see you. He said, well, I'm 80. I said, Dan, you got to see this guy. Don't listen to them.
He's 80 years old and he thinks he's got to have pain everywhere.
Yeah. And he said,
no, that does not work that way.
And I say, when I'm trying to get to people to understand something, I don't make any money whether you see 20 people, you don't see any people. It doesn't matter to me one way or the other.
Neither do I.
Exactly. No. And the thing is to do.
That's a joke.
No, the thing is that before, why even go in for surgery? Just see you. I mean, what's the big deal? It doesn't cost anything.
That's right.
It's not going to hurt you.
Once you're operated, you can't reverse that.
No.
You got to remember that. Once you go to a surgeon, they're going to do for you what they need to do based on what they know.
They're a surgeon,
but they cannot reverse it once it's done. But whatever we do is reversible.
Yeah.
We can't hurt you.
No.
Now, we're talking about the narcotics. There's another article in the Wall Street Journal. Employers tackle abuse of painkillers.
Mm-hmm.
That's because the doctors are prescribing these things for no reason. They're
I
not
don't think they
examining
know anything else.
It's like $79 billion worth a year, it says right here. $79 billion worth a year. I don't know where they get these figures, but
well, the National Institute
now
says
they have other companies that get involved with that. Now here's a guy who runs a company, and they do other analysis of the patients, and they can tell you who's going to take narcotics and who isn't.
Oh, really?
But the whole
wow.
thing is baloney, because the one who does it is the MDs.
Mm-hmm.
They're the ones that are prescribing this. So this guy has no job. If it was me, he would not have a job. Because there would be no reason.
Hey, Fred, it's a good thing he likes us. We
we're out of job.
We still got it.
Well, only to show you that he'll get another job doing something else. But
look,
just going to show you that there's what I'm talking about. There is an answer to this, and here's another article: Workers' Comp pushes other pain therapy. Now, the workers' comps are getting involved with this. The wrong people are doing it. It's the physicians that need to be trained and how to.
Well, it's amazing that workers' comp is looking for a different solution to the problem, because it doesn't work.
No, it doesn't work.
This doesn't work.
But none of them have the system that we've established, where you take a history, you do a clinical exam, special films, you treat the thing, and they're back to work. Same job, no time off.
You're going for an MRI.
This is costing industry millions of dollars.
Because you're going for an MRI. To get an MRI right now is almost $2,500, depending on
what does it tell you?
Doesn't tell you anything.
Doesn't tell you anything.
Doesn't tell you where the pain came. It's a one-dimensional thing.
Yeah, people bring MRIs and on a disc, and they push it through my window and right up into my face. Here's my MRI.
I know. I've been there.
Oh, thank you for bringing your MRI.
Oh,
it's
the
a
MRI.
useless.
Oh, God,
it's
I can't hear
all
it.
right for that day, but it doesn't tell you cause and effect relationships. It doesn't tell you where that pain is and why it's there. But our analysis will do that.
Right.
And at the end of your half-hour experience with me, we have what we call a history, it's an analysis of what your problem is. So your problem is this. It's because of this, and this is what we can do with it.
Well, when you go to Channel 19 and you watch what he does,
you don't want that treatment. You have lost everything.
Yeah.
Because you'll never get it again. That is 100% effective.
and it's funny because a lot of people say, "Oh, you're gonna give me a shot? I really don't like shots." So you won't even feel it. The kid plays football, gets hit in the head. He didn't even feel it. He said he felt the alcohol, but he didn't feel the shot.
Oh,
I'm serious.
He had that concussion, I
Yes.
think. Yes, that was the guy.
Yeah.
Football player.
Good-looking kid.
And he wanted it. He said, "You have anything for this dizziness I'm
Yeah.
getting?" I said, "Absolutely." And he's a young kid. So I
think it was in high school, right?
Yeah,
Like, is
and
it-
I did it all for him. But the parents
yeah,
brought him
senior
in, not
year.
the coach. See,
No.
they're not getting good leadership from the coaches. And
They don't know any better. They don't want to know any
it's
better.
easy to know. All they have to do is call up. Where's the calls? There's no calls on there.
Well, this is the beginning of Thanksgiving week.
Yeah, well,
A lot of people
what
take
about
over a
last
whole
week?
week for that. Oh, by the way, we'll be on. Are you okay next Sunday?
Yeah.
Yeah, you're going to be okay next Sunday?
Yeah, it might be Carol.
Okay. Well,
It'll probably be Carol.
we suffer with what we got. Okay, and you're okay Sunday, Doc.
Yeah.
Okay. What a lot of people don't understand, and I have this with people that I talk to all over. They don't understand that Dr. Pannozzo actually finds where the problem is. He has a C-arm, and if anyone wants to look up to see what a C-arm is, you'll understand it's not. It's a very expensive machinery, where he could actually show you
It's an X-ray.
that day, that minute where that pain is.
That's right.
Just getting a shot doesn't mean anything if you can't find where the source came from.
It has to be in exactly the right spot.
Exactly.
And most of the doctors don't do it.
They don't even
And
have the machine.
That's why they come into my office and they say, "Oh, I had all those shots." I said, "No, you haven't. Had you had the right shots, you wouldn't be here today."
You know, it's really funny. Shots are one thing.
Right.
Doctors, why they do what they do. I don't even want to go down that road anymore. I'm tired of doing that. But the bottom line here is at the end of the game, are you in pain? And if you're not in pain, that's really the relative part.
That's very
of the whole
smart what you
story.
said. That
Not
really
only
is.
that, inside of 2 minutes, you're going to lose that pain.
That's right. So isn't that the important factor?
To me, it is.
You know,
Yeah.
the NFL makes a lot of money, Doc. If they don't want to bring their players back because they want to give paychecks to doctors and everybody else in the game, everybody else. I'm not saying doctors is
Right.
a business. I can't fault the guy for making money. I just can't.
No.
But if you want him in the game or you want to relieve of your pain, 800-889-0267, give us a call.
But a lot of these things get in the hands of lawyers, like the settlement that's coming up for the concussion.
$1 billion.
I mean, there's a lot of money going to these players. For what? They don't have anything. They have neck problems.
Well-
and they're going to. What about the breast implants? You know, we talked about
Another
this
lawsuit,
before.
right?
Oh, yeah, big lawsuit.
You have silicone that is not reactive to the body at all, and they blame all the. Do you ever see the list of diseases that they blame on the silicone?
Yeah.
It's like this big. I mean, it's huge, and none of it was
They are
true.
huge, Doc.
None of it was true. All of a sudden, you don't hear about it anymore because the money got spent.
We live in a
And that's it.
we live in a very litigious world. Everybody wants to sue somebody for something.
Well, the doctors are allowing this.
Yeah.
The lawyers are buying these doctors out, and so they do a report on it, and they're out of their element. They don't have a clue.
Well, you know, to me,
I'm serious about this, and I don't even see this, so I'm not losing anything by saying this.
I always say to people, I say, look, if you're skeptical, come in to his office and just sit there. Talk to
Well,
somebody.
he brings the office to you now. There's no excuse.
Oh.
On Wednesdays and Friday, that is shot from his office. There is absolutely no excuse not to see this man.
There's nothing made up on that.
No.
I'm very proud of that because that photographer follows me around, and whatever he sees, he records, and it goes on. And everything is good because I know it's good because we test them.
And there's no
before and after.
We don't rehearse. People come in and
No rehearsal.
I watched the lady. I can't remember she came in for I think migraine.
You're watching a lady?
Well, I was watching the show. I like to watch the shows. I critique it and I watch, and he sits down there and he's got like 18 pages and this and that. They ask every question under the sun because he did it to me. He said, "I'm asking you, where's the pain?" I said, "Wait a minute," and he found where my pain was, and it was done.
The funniest lady was the one that had the ringing in the ears.
Oh yes,
And she was describing to him what she was hearing.
yeah, I know, and she didn't come back because she was
No?
cured.
That's right. But is that the one that was on that program? She was talking to me, and all of a sudden she says, "I don't hear it. It's gone."
Where'd it go?
Well, that's the reason we do it. You know what it is? It is, to me, it boggles my mind. Maybe it's because I'm Jewish and I don't like pain. Okay, but it boggles my
Nothing
mind.
to do with being Jewish.
Look, there was an email, and it said a Jewish woman went into a restaurant and didn't turn back any of her food. Think about that. Jewish women always turn. It's not hot. It's too cold. It's not rare. But what I'm saying is this: if you're happy living in pain, God bless you, because I can't. For me to go in and in 2 seconds get a shot in my groin, where athletes are out for 4 to 6 weeks, but they don't. To me, boggles my mind.
Sitting on a bench for 6 weeks with a hamstring. I mean, how many times do we talk about this?
Yeah.
It's just totally.
Why do they do that? Why? I don't understand the mindset of the coaches and the people involved with that, because it's really stupid. They don't know what to do with it. That's why.
I got an idea for a great commercial, Freddie. We have a player that's not a real player, falls down, and the therapists run out and they go, "So what do you think we should do?" "I don't know. What do you think we should do?" I said, "I think we should call Dr. Pannozzo at 5613-815-800."
Pannozzo runs out with a needle.
Then he runs out and gives him the shot.
That would work.
I watch 19 guys come out. They move the guy's leg this way. They move the guy's leg the other way. And he comes out and says, "Well, quarterback Freddy Santori will be out for the next 6 weeks because he's got," ready for this one, Doc? "A pulled ACL."
That happened
pulled
to
ACL.
That happened to Fitzpatrick.
Talking about ACL, there's a question.
There is a question about a football player, yeah.
All right, you guys keep talking about
But
it.
Fitzpatrick from the Jets, they
Yes.
benched him because he has a pulled MCL.
Oh, here's this
Well,
one.
they're talking about, did you find it? They're
Yeah.
talking about stability
Yes.
of the knee. But the ACL has nothing to do with stability. The stability of the knee comes from the capsule around it
So
that
when
holds
you
the bones together.
so when you
That's
run
your
to the left and you cut back to the right,
you're not pulling on the ACL when you do that.
but that's what they were telling them.
Yeah, that's wrong. It's just a lie. It's not true. You have to destroy the capsule before you get to it, because it's in the middle. Okay? You have a knee like this, surrounded by ligaments. You have to destroy the ligament around that before you can get to the middle.
So what stabilizes the knee? The ligament that
The
goes
ligament
around?
around it.
So they're operating on the interior and they're telling you that
It's a
that's what's
made-up deal. It should not be done. They're ruining careers with that.
Well, here's a good one, Doc, before I do that one. JJ from San Diego writes, "I finally got to see the show on Channel 19, and I have to tell you, the show is unreal. People actually come in and share their pain problems, but more amazingly is how you cure them. I have hurting ankles, and my doctor wants to put me in a boot. Can you tell me how I can get my ankles fixed without the boot?"
Yeah, usually the ankle, you examine the ankle, and usually it's a normal thing.
It's a referred pain.
So it's a referred pain from somewhere else. So you treat that, and it goes away.
And the lady that
Now,
you
know,
hear...
people have this problem. They
Yeah.
have tingling in the fingers, too. It's a one-day treatment.
Well, you know what's funny is
Ding.
Leah, who does our commercials because she believes so much in you, had that same problem with the ankle.
The same problem, right?
And, here is a very active woman that does everything, surfing, running, climbs mountains. And he told her, "I'm going to give you a shot in the ankle, and you'll be wearing a boot for about 2 weeks."
Yeah.
Freddie, it was the most amazing. Leah looked at me and said, "So give me a shot in my back?" She walked up and down, found out where the problem was, and she said, "Why did you give me the shot there? My ankle's better." And she looked at him like, I mean,
Yeah, it's a standard way we look at things. Remember,
Amazing.
cause and effect.
Yeah.
If you don't find anything at the ankle, that's not the cause. You got to find the cause of that symptom. Now, you can't tell people they don't have the pain. They do, and they know where it is. The thing about it is to know where it starts and to take care of it. And the patient cannot tell you that. They
Here
can
we go.
tell you where the pain, they feel it, but they can't tell you where it's from.
Here's my ACL
You have to
one.
know that stuff.
Becky from New York City, I didn't mean to interrupt you, Doc, but what you asked for me before, I just found it. Becky from New York City writes, "I've watched your show many times, and my son, who plays high school football, has a torn ACL, which you say does not exist. They explain that if he doesn't have the surgery, he will not have the lateral movement he needs to play the game. I am confused because I told them about you, and they said they know all about you, but stability is not something you can guarantee. Wow. I
Well,
wish
that's
you,
nice. They didn't ask me.
I wish you read the question on the air because I want to clear the air and get going right away. We'll be able to still play after a stable knee. That's okay. Go ahead.
Yeah, you're going to have a stable knee no matter what. Just
Right.
don't get operated. That's all. This kid is too young. Do not operate somebody that's young. Let him grow first.
Becky, if let me just give you Dr. Pannozzo's personal number that will answer any time of the day. It's 561-381-5800. It's 561-381-5800. Explain.
Where are they from?
They're from New York City.
Well, you ought to look for the sake of this kid. Fly
worth it.
down there, get him fixed, and then fly back. I mean, you'll be very happy you did that.
If you call up Dr. Pannozzo and
And
make
don't
an
forget,
appointment.
he's got a future. What is
Yeah,
he
of
going
course
to
he
be doing
does.
for his future? Remember that 5-year plan? You got to have a 5-year plan. Well, how's he going to be in 5 years? He's going to be limping around with a scar on his knee.
Well, not only that, he won't be able to play professional football or college football, which is which is
you
a
can
stepping stone.
you can play. I mean, the kid from the Rams, which is
Right.
leading all rushes. Last year he came back from a tear ACL operation and he did real fine. But not everybody's the same. We
No.
talked about quality
Now-
of player.
Right. Now, if you follow that kid for a couple of years, you'll find out that knee gets stiffer and stiffer and stiffer. And you mentioned your friend from the gym all the time, and that's what happened to him. He had both knees operated, and he got stiffer and stiffer and stiffer.
Yeah.
And we took care of it, of course, but you don't put yourself in that position unless you have to.
Okay, let's go. Got
I'm
another
talking like a father and a physician now.
No,
you
it's
never
true.
want to
I
do
mean,
that
you
to
know-
your kid. Never.
I mean, you go back to the old.
I've seen 14-year-olds with screws in their spine.
Oh, good.
I
We
mean,
got
you don't wanna do
I got a
that.
scoliosis
Yeah, go
one
ahead,
for you.
go
Here we
ahead.
go. I'm glad you brought that up. You can tell how rehearsed the show is, folks. Allison from Boston writes, my youngest daughter has scoliosis and complains about how at 13 years of age, she doesn't want to go out and meet people. We have been to doctors and have discussed our options, and she will not do it. She found your show while looking on the internet and asked me to write in. Kids, that's all they do is they live on the internet. It's great. Can you explain to me how the... I'm sorry?
Sorry, that was me.
Oh, okay. Can you explain to me how the procedure is done and how long it takes and what's the cost to this? I'm shocked that you have a different way to handle this situation. And she assures me that you do it is safe, not complicated, and I will be amazed. I will be listening to your show.
This is a very smart teenager.
Yes, she is.
Yes, she's very good.
Yeah.
Yes.
It's her body. Why not?
Well, she's done her research.
Yeah, that's good.
You never want to go to a surgeon first. Surgery is okay if that's the last thing you can do, then do that. But what we're offering you is non-surgical.
Sure.
There is no way you can have any downside to what we do. It's very safe, and you see it improve yourself right away. I mean, especially this age group.
Amazing.
We had two 16-year-olds girls with this problem.
And we have that on tape, right, Fredo? 16-year-old girls? Yes,
Yeah.
good.
And they both improved dramatically while they were there.
Yeah.
In the treatment time that they had on that one day. And they all improved. You could see it. The shoulders dropped. The rotation took place. I mean, it's dramatic.
You could go to the App Store and you could get Dr. Pannozzo's app at no charge, where you could actually see these patients.
Pannozzo.tv.
And you go also see at Pannozzo.tv.
No, but that's the app. Is Pannozzo.tv.
Yeah, Pannozzo, and you could actually see this stuff that's really working.
Yeah, so this is really true. People ought to invest in their children,
Yes,
because that's all you have at the end.
that's
You
right.
can only leave your children and their children, and that's all you got. So you want to take care of them
Especially at 13, and it's much easier at 13 than
Oh,
it is at 21 and 25.
It's so easy, and we're going to give her a social life.
Yeah. You know, if you're 13 years old, you know how kids are. At 13, they see you hunched over, they make
All
fun
there
of her.
is a little scar tissue holding the bones crooked, that's all.
Amazing.
All that simple, and you just find out where it is, and then we can do that, and we just treat it right then and there, and it turns right in front of your eyes.
It's funny because the way they treat that particular illness is horrible. You know,
It's
the
worse
metal
than
and-
having the disease.
I mean, what the hell is that?
my
That's
God.
that's like
Rots.
medieval medicine.
Yeah, that's what it is. Medieval medicine.
So
And
it's
those
changed.
guys don't want to learn anything either. They
Because
want to
if-
keep doing the same thing, and they're ruining these kids.
Doc, it's $150,000 surgery.
Well, the hospital gets most of it.
Yeah, and the doctor does pretty good himself.
I don't care who's getting
I-
what.
Yeah.
I don't care who's getting what. I'm not getting it.
Well, neither am I. So let me ask you a question.
For us, it's pretty cheap. I mean,
That's what I'm saying. I mean, one of the things that Alice from Boston wants to know is on average cost.
how much does it cost? Well, it's cost per treatment.
Yeah,
Which is,
because you can't cure scoliosis with one shot up.
I guarantee you one thing: it's not $150,000.
I guarantee it's not even 10% of $150,000. How's that?
no, it's $2,000 or less.
Yeah.
What's wrong with that? And you're cured.
Yeah.
And you got your life again.
And there's no metal being
No.
inserted into your body.
But they're under pressure from the obstetricians, pediatricians,
Mm-hmm.
which refers to the pediatric surgeon.
Right.
They have that such a thing, pediatric surgery. I mean, the whole thing is just a game. I mean, I was trained like that. You know, I was involved with it when this was going on, and you'd see all this happening. The pediatrician refers to the surgeon, the therapy gets involved, and
So let me tell everybody
you
up
get
front.
nowhere.
Dr. Pannozzo is a graduate of the Big O
The Ohio State,
and did his internship at
Philadelphia General,
and decided
residency, Ohio State.
decided to go into musculoskeletal because he
Musculoskeletal.
felt that was the best thing for people and him.
That wasn't offered
No.
when I came out of training. Got another question?
Sure,
there?
boss. I got one from the guy that we were talking about with the NFL. He's my boss. I do whatever he says. I love this guy. Joey from Boston writes, I read how concussions, again, are rising in the NFL and lawsuits that was published for anyone the NFL signed up for. My oldest son is on the bench for 4 weeks due to protocol. I just saw how you talked about concussions and how it doesn't affect the brain but the neck. If he has headaches and blackouts, is that coming from the neck?
Yes.
Okay, explain that, doctor, because these are lay people that don't understand.
Well, you can't hurt the brain.
I found that out.
It's encased in fluid and a bone structure.
Right.
You can't hurt it. Now, what does move and is an injured is the top of the neck where it meets the skull. That's where these things happen, and it's all treatable. All treatable, just like that. Bing, bing.
I got a call from a guy from Arizona. I think his name is Dr. Pannozzo.
Oh,
Hold on.
he finally get up.
Nice to see you up and around, buddy. What's going on?
Morning.
How you
Or
doing?
Afternoon over there, whatever it is.
we're talking about
It's
everything.
only a 2-hour difference.
Concussions and everything else, and I got you both on the show. Let me read one from Ronnie from New York City, who writes, Dr. Pannozzo, I've watched you for months on Manhattan Cable, and I'm ready to go down and fix my lower back. They say I have a bulging disc and need surgery to remove it. I told them, forget about it. I'm going to see Dr. Pannozzo. How long does it take to have the disc back in place, and will, excuse me, I need follow-up. Just want to make plans of how long I'm going to have to be in Florida. May bring my youngest sister with me because she has a bad shoulder, and they want to operate for a torn ligament. Okay? Tell her she wants to know your address, 16244 Whitten Boulevard. Am I right?
No.
Okay, where do you live? Go ahead.
Good information, Les.
16244 South Military Trail.
Oh, South Military.
Yeah, Suite 740, and Delray Beach, Florida, 33484.
Okay, good.
Can't miss it. Goes right to it. Except if you have that other service, and it puts you next door. Not my office.
So they're talking about let's go with the bulging disc first.
Well, see, that comes from an MRI read.
Okay.
Bulging disc. I don't even know what they mean by that.
Okay.
And which side is bulging? They don't tell you that.
Okay.
So that's the value of it. There is no value to that reading. So anyway, the discs are not the discs that you think of.
Mhm.
They're ligaments that hold the disc in. It's
Right.
the disc is. They talk about nutrients going to the disc. That's baloney. There is no nutrients going to that disc. It's just a liquid thing. There's no nutrients there. It's not a living cell thing like you would imagine.
Mhm.
And then it's surrounded by a ligament that holds it in. Now that's where the pain is,
Okay.
the ligament. So if you know where that is, you can treat it directly. There's a cause and effect relationship there. Say if you have a pain on one side from a ligament,
Mhm.
you have to look at the other side because that may be scarred down there. So the Medicare people asked me one time, how come you use so many shots? Well, because you have to take care of not only the problem, but why the problem is there. You have to take care of all of it on one day. That's how you get relief. So you have to understand it's a complicated issue, and you have to be able to think about it. It's not just getting an MRI. We don't even get MRIs that much.
And Ronnie wants to know, Doc, how long does this normally take?
One day.
Yeah, so Ronnie, if you want to call Dr. Pannozzo after the show, it's 561-381-5800.
Yeah, how we do that, if he wants to, anybody else wants to fly in, what happens, we see somebody in the morning, and we do our thing for them, and then we see them at 4 o'clock in the afternoon. Now, half of that medication's already gone by that time. And so that we don't overprescribe anything. We don't prescribe anything anyway.
Right.
But that's how we do it. So when you leave, you're going to leave there with most of your problems out of the way.
Wow.
That's one day.
What do you think about that, Paul?
It's the plan there. We can go in the morning and then in the evening. It's actually true. You know, if you really have to meet a schedule, that works out. It's true that the drug is you know, the half-life is short, 5 hours. So go in the morning and the afternoon. If you know, for people that are flying in, flying out, it's the medication we use, it gives us the flexibility to do that.
Remember that on the analysis, you know where all the problems are. All we're doing is wiping them out one by one.
Right.
There's no magic to this.
So
It's a plan. These are your problems. This is why that's there, and this is how we approach it. Dung, 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 dung. See you twice,
That's
and
the
then
plan.
you fly out the next day, and you're done.
And if you call up Dr. Pannozzo and you set it up, if you want, I'll be more than happy to set you up with a hotel on the beach and
In fact,
enjoy it.
Paul would tell you, I just was over there, and he took care of me just like that.
And you take and I know that's amazing. So tell me how many doctors that operated on themselves. All right, you can't do that. So how you feeling now after your son?
Well, of course, you're going to feel terrific.
Your father looks good. I'm trying to convince your father every couple of months.
I didn't pay him to say that either.
No, I know you didn't, because he's not going to pay you. I can tell you that right now. We have some good questions here today, Doc. Let's see. I want to get one that okay. Sal from Boston writes, I heard your show about rehab centers using your procedure with no narcotics to help solve the problem. Well, nobody does what you do, okay? I want to applaud you for your efforts because my daughter is in rehab and it was because of an overdose of pain meds. Again, no excuse, but they are addictive, and she had no one to help her. You could help many across the country who have these problems. She was in a car accident, had a bad back, and couldn't work.
Right.
Her hip was out of whack, and they gave her meds to control the pain. I went downhill from there. She went downhill from there, I'm sorry. Can her hip be fixed without a hip replacement?
Well, first of all, you don't know whether it's a hip or not.
Right.
She didn't improve. So
Right, may not.
I would question in my mind whether they were treating the right area.
Yeah.
The hip area is a referral area. You have to know where that pain's from. So, we spent a lot of time doing this, Paul and I. We did a lot of research on these things, and I would tell you, it works. And it's hard to explain to people.
A lot of times people, that's what's commonly confused, the back and the hip.
Yeah.
Every day. And sometimes they're tough to figure out what's what. But that happens a lot.
A lot of times people will say, well, your hip went bad again. We have to replace the hip. But that's not a good reason.
No.
Because, first of all, you don't have any pain fibers there.
Right.
I mean, when they replace your hip, what do you have? A piece of metal. So where's the pain from? Probably from the back. See?
But I've
So
seen...
you have to know the pain patterns and how to examine for it. And people listening to this ought to understand this is a very serious
scientific.
problem. Yeah, very scientific.
Well, what a lot of people don't know, Paul, I've seen your dad with people who came in with things that were bothering them where he fixed that wasn't what was... see if I could... Like Leah. Leah came in with a bad ankle. Was told that she's going to need this, that, and the other thing. Your father watched the way she walked and gave her a shot in an entirely different place, and she looked at me and said, wow. And to her not to have to
That's all she said was wow.
No, she looked at me and said, wow. And then she said, I'm going to wait a while. She walked up and down. She said, I'm going to call you tomorrow, Wes, and tell you. Calls me and she says, amazing. And that's why she does her commercial, because she really believes in what he does.
We do this 18 to 20 times a day.
Yes.
Just what you're talking about.
And it's amazing. Paul, I don't know if your dad told you this story. I was there one day, just walked in. I was going to see how he was doing, maybe grab a bite to eat. And this lady who had been suffering from migraines, and she was a hairdresser, and she had ringing in the ear. She got dizzy. When she went in for her shot, her husband said, I hope this works, because I don't know what to do. She came out, and she said for the first time in her life.
And that was, 5 minutes?
I mean, I was talking to him. She was right out.
Yeah, it was 5 minutes.
She hasn't had any pain. I mean, she woke up with pain, went to sleep with pain, and she walked around, and she said, when do I see you again?
And you never know. There is no test for migraine.
Right. That's true.
If somebody says they have a headache, you got to know where that's from and what the pattern is.
Mm-hmm.
So you can glean from the history whether they're telling the truth or whether they know what they're talking about or where it's from. But you got to know your stuff. I mean, you can't just, if you have a headache, here's a prescription. Stuff is like over $100 a dose or a month. I don't know. It's just a huge amount of money.
Well, Botox is $1,500.
None of it's based on what the problem is.
Right. Well, Paul, we had, I brought in one person, I brought in two people with migraines, and one of them was a sales rep who had trouble with vertigo, and your dad fixed her in one day, because after she was done, we went to lunch, and she looked at me and said, I have no pain. First time, have no pain, which is amazing. I mean, look at it. People are, I mean, I'm sorry, Paul, it just boggles my mind as many times as I've seen
Paul
this.
gets the same results, too.
Oh, I would imagine. What are your results with migraines, vertigo, and the ringing? Same thing?
Yeah, headache, all those symptoms, especially the headache, can come from the neck. Interesting, I wanted to add something. I just came across an article about someone having tinnitus, and they talked about doing a radio frequency, a nerve burn procedure in the neck for that.
Wow.
And I was thinking...
Oh, I saw that article. I didn't read it, but where were they going to do that?
Wow.
Where were they going to burn it out? I mean, that should not be done. You should never touch a nerve at all.
And, so I was thinking, hey, what you can do is just, as long as you just get the medication in the right spot, you don't need to do that. Mm-hmm. That's a destructive procedure. I wouldn't want to do that particular procedure for that problem in me at all. So we have a good result just by putting a little medication up to the higher joints. As long as
where were they going to
do?
Where were they going to burn it out?
Pretty darn well.
What were they going to burn out? I didn't follow that.
It was, I believe, going to be part of the parasympathetic.
Oh, okay. Yeah, see, they're completely off.
I have to review it, but
that's never going to work. It's in the wrong place.
What is the parasympathetic?
It's just a bunch of nerves.
Okay.
Hey, who found it first, the doc or his son?
Well, I know that I can answer that question. The doc, because he actually did the brain, went and studied the brain with another doctor at FAU, or which school?
Nova, I think.
Nova, which is a great school.
So you found the cure to that first?
Yeah, I was talking to him about it, and I said, "What is there to do this?" And that's how research is done. You get an idea, and you kind of work it around. And I said, "I think it's COC1, and if you get one, tell me about it and tell me if it works or not." So, and in the meantime, I went to the medical school and we dissected 3 bodies. Mm-hmm. It was about an hour and a half, and we looked at that area only. We didn't do the whole thing.
Right.
Just that area on 3 of them. And I said, "Well, doctor, I don't see any danger here." And he said, "You're right. There isn't anything here. Mm-hmm. Just a joint." I said, "Okay, that's what we're going to do." So that's how we did it.
What do you think about that, Paul?
Yeah, it's definitely a good way to go.
Now, Paul uses, this is how research is done, see. He uses that machine, the C-arm, to locate that. And he has an ability to see it in there. I don't. I tell you the truth. So I developed a way of doing it without that. And it works just as well. And in fact, it works very nice.
I'm waiting to see a patient come out of your migraine procedure and say to me in front of you, this doesn't work. I haven't seen that yet.
Yeah, well, that's right. That happens once in a while. So I have them sit in the waiting room for a couple of minutes, and I said, if your headache goes, you can leave. And they leave.
Paul, do you do the same thing? You make them sit in the waiting room until the pain goes away?
Yeah, what I'd say is that if people come in with a headache, unless they have a brain tumor or an aneurysm, it's from that neck, and you will get a positive result by treating the neck instead of the muscle of the head or nerves that go up. Treat the actual neck. That pain is coming from there.
It is amazing, isn't it?
I'll tell you, Paul, the biggest source of patients I have now is ringing in the ears.
Yeah.
People will call about their wife. Say, my wife doesn't get out of bed. She has all this pain. I said, well, bring her right in. We'll take care of it, which we do. Yeah, it's a growth business because we're the only one that offers a treatment for this. No one else is offering anything.
And you know what, folks? All I could do is tell you this. If you want to do all this, everyone I've met has done the same thing. Went for the Botox, went to the clinic, took the medications, blah, 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 and they end up with you. And guess what?
It works. Any more questions?
Oh, sure. I got a lot of questions here, Doc. Asia from New York City writes, my son hurt his neck playing soccer, and the doctors want to operate ligaments around the neck. I've never heard of this before and wanted to ask if you ever heard of this condition. I asked them about inflammation around the neck and how we could help reduce, and they told me that there was no way without surgery. They want to stabilize the neck area. Can you please help me understand?
Yes, okay, the thinking is wrong by the surgeon.
Okay.
You don't want to stabilize the area.
Okay.
You want to mobilize the area. Mobilize, make it move better.
Right.
Move better without pain. More surgery you do, the more scar tissue you get, the less motion you get, and the more pain you get.
Yeah.
So you don't want to do that. No, we have the answer to that, and it's not a surgical procedure at all. Especially the young kid. I mean, you never want to operate a young kid neck, you know, absolutely never.
Kid is 12 years old.
Yeah, 12 years old. I mean, you know.
Okay. Ralph from
Hard
North.
to answer that question without information, you know. Yeah, we don't know the extent of the injury or whatnot. Odds are does not need any kind of surgical procedure whatsoever. But
well, you do repeat exams.
Get a little more detail from the family member there.
Yeah, you treat what you think you have, and then you repeat the exam to pick up anything else. But the main thing is mobilization is the cure. Okay. Mobilization.
Well, I found out about what you told me about all these guys that wear the belts in the gym and the stabilizing. I have all the guys I told them about. They take the belt off now, because seriously.
Yeah, that's true.
Amazing. Okay. Well, I think I got one more in, Doc.
Okay.
Ralph from North Dakota writes, saw your show on the internet as I am laid up with a bad lower back. I have a horse ranch here, and in Dakota, I'm up until, okay, hold on.
She rides horses.
I have a horse ranch here, and I'm up until the doctors replace my right hip. My son found your website, and I wanted to see and get more information about what you can do to help me. I'm 59 years young, and I've been riding for over 40 years. Pain shoot up and down my legs as well.
Yeah, well, that's probably coming from the back. So you don't want to replace the hip.
Okay. So, folks,
you can tell if the hip's a problem because it bothers you walking.
Yeah.
So, Doc,
a bad hip will give you more and more pain as you walk, not less and less. A lower back will give you less and less pain as you walk.
Really?
So that's a big distinction on the history alone. Yeah.
So you fix this guy up and be riding horses?
Yeah.
So let me tell you, 561 Ralph 381-5800, and I got news for you. You know what? Here's what I always say to everybody. You got nothing to lose with these two doctors. Absolutely nothing to lose.
You got a pain.
You got pain to lose.
I like that. You got nothing to lose but pain. That's
Yeah.
gonna be. I like that. Not a The doc.
I'm going to write that down.
I mean, I taught this. Here's the worst thing. I taught this guy how to be a marketing guy now. Folks, it's getting to that time, and I just want to say, Paul.
The best one I like is limp in and leap out.
Yes, that's a good one.
That works.
There you go.
Okay. So my producer is holding up
Thanks,
his hand. Paul, thank you again for calling. We always enjoy having both of you guys on together so we could get different aspects. 561-381-5800. Paul, could you give out your number, please?
623-776-8686.
One day I'm going to meet you, buddy. I'm looking forward to actually meeting you when you come down here. So, folks, I want to say thank you. We're having a great Sunday. God bless America. God bless our troops. And God bless you, Dr. Pannozzo, who's helped everybody along the way. 561-381-5800. Call Dr. Pannozzo and get rid of pain forever.
All right. See you next week.
See you next
Bye.
week.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.
1230 WBZT West Palm Beach, an iHeartRadio station. 1230 WBZT West Palm Beach, an iHeartRadio station.